Word on Health, the report with its finger on the pulse of popular medicine with Paul Pennington. Word on Health, for your very best of health.
Hello and thank you for listening. In this edition of the Word on Health podcast, I'll be talking to Dr. Ron Daniels, founder of the UK Sepsis Trust, and as Heart Health Month comes to a close, I'll be joined by Professor Liz Hughes from the charity Heart UK to look at cholesterol. But first, as you may be aware, Rare Disease Day, which occurs at the end of February each year, raises awareness and seeks to generate change for the 3.5 million people in the UK and 300 million across the world living with a rare disease, their families and carers. In this first section of the Word on Health podcast, I'm going to focus on two of them, progressive supranuclear palsy and corticobasal degeneration. My guest is consultant neurologist Ed Jabbari. Ed, welcome to the podcast. Tell us a little bit about yourself.
Thanks very much for having me. I'm based at the National Hospital for Neurology and Neurosurgery in London, and I'm also a researcher. So my research group is based at the UCL Queen Square Institute of Neurology, and my research mainly focuses on Parkinsonian disorders, in particular Parkinson's disease and progressive supranuclear palsy.
So, what are progressive supranuclear palsy and corticobasal degeneration?
Progressive supranuclear palsy, or PSP, and corticobasal degeneration, or CBD, these are neurodegenerative conditions. So what I mean by neurodegenerative is there is a progressive wearing down of certain parts of the brain, and that manifests in a number of ways in patients, problems with movement, problems with thinking, behavior. So they do resemble more common neurodegenerative disorders like Parkinson's disease or Alzheimer's disease, but they are distinct disorders in themselves.
What's the prevalence and why are they referred to as being complex?
The prevalence of these disorders are such that they affect around 5 to 10 per 100,000. So by definition, they are rarer than the more common neurodegenerative diseases like Parkinson's disease, Alzheimer's, and frontotemporal dementia. And the complexity really refers to the fact that they affect multiple systems in the brain and the body. So as I mentioned earlier, problems with movement, thinking, behavior, and other manifestations as well.
I understand that PSP and CBD differ primarily in the specific brain regions affected and their typical physical presentations, but there are symptom overlaps, and given that aspects of these conditions can mimic more widely known neurological conditions, are they commonly misdiagnosed?
So this is the trouble with PSP and CBD, that the first symptoms that patients develop are often quite non-specific. Problems with balance and problems with vision, these can just be put down to, really common things that you shouldn't really have to worry about. There is often a delay in that initial period before patients seek medical attention. They present to their GP, the GP is unsure of what's going on. They then get referred to see a neurologist, and then to a jobbing neurologist. Because of the rarity of these conditions, often patients are misdiagnosed as having Parkinson's disease. Then they tend to progress at a rate that is faster than we would commonly see in Parkinson's disease. And there are additional clinical features that then manifest over time. And only then do they get referred to a specialist, and only then does the correct diagnosis come. And often that then leads to patients having a diagnostic delay of up to 3 to 4 years. And in these more rapidly progressive diseases like PSP and CBD, that means that we are effectively diagnosing these patients in the advanced stages of the disease. So really, it's an awful diagnostic journey of uncertainty for our patients and their families to have to go through.
We should highlight that PSP typically presents with symmetrical stiffness and early frequent backward falls. CBD is characterized by asymmetrical symptoms, usually starting with stiffness, clumsiness, or weakness on just one side of the body. There are differences in eye movement problems between the two, and a distinctive symptom of CBD is known as alien limb phenomenon, where a limb, usually an arm, moves involuntary or feels as if it has a mind of its own. Who typically develops PSP or CBD?
These are late onset disorders, so the typical age of onset of symptoms is in the early to mid-60s. There is, of course, a spectrum. We do see some patients with an earlier presentation and some with a later presentation, but typically it's in the early to mid-60s. Males and females relatively equally, I would say, and then we do see this condition in all ethnicities. We refer to PSP and CBD as sporadic disorders. So what this means is that there is no, in 99.9% of cases, there is no identifiable genetic spelling mistake in someone's DNA that means that this is a genetic condition that can be passed down to multiple family members. So therefore, when we say that it's a sporadic disorder, we think that it's likely to be due to a combination of common genetic risk factors that you and I have, and also environmental factors. Now, the environmental factors, there's been far less work on this with regards to PSP than the genetic factors side of things. So we know that there are certain common genetic factors that increase or decrease one's risk of developing PSP, as well as genetic factors that influence how quickly or slowly your disease progresses. And the reason why that's important, Paul, is that these may represent potential treatment targets. And that's something that we, as a research group at UCL, are working on. The particular treatment target that we're working on at the moment is a target called LRRK2. Now, this is a really interesting target because LRRK2 for decades now has been associated with Parkinson's disease, both familial and sporadic forms of Parkinson's disease. So really, this was the first time our research study that we did 4 years ago really was the first to highlight this link between the progression of PSP and LRRK2. What we've now done in the last couple of years is translating that finding into measurable amounts of that LRRK2 protein in patient blood samples and spinal fluid samples. And again, that's showing real promise in terms of predicting the progression of PSP. And finally, what we're hoping to do in the next year or so is liaise with drug companies that are currently trialing LRRK2 targeting drugs in Parkinson's disease and seeing if we can extend that approach to PSP patients. So really watch this space because we are quite hopeful that there will be a LRRK2 targeting trial for PSP patients available in the next year or so.
The current treatment regime for PSP and CBD focuses on symptom management, as no cure or disease-modifying therapies are currently available in clinical practice, which I understand over time requires a multidisciplinary team approach to help patients with quality of life. How do these diseases progress?
Typically, patients, when they first develop problems with their balance, will then start to fall regularly. Accompanied with that is problems with stiffening up and slowing down in general in movements. Then the problems with the vision become more problematic, so difficulty looking up and down. So patients find it really hard to do everyday tasks like watching television, reading newspapers, driving their car. Then there may be manifestations of cognitive and behavioral symptoms, so a lot of apathy, impulsivity. That's typically how the condition progresses. And then in the latter stages of the disease, it then really profoundly affects speech and swallowing. And ultimately, that is how most patients with PSP succumb to their illness because of the difficulties with swallowing. This is a brutal disease. It's really horrible when you see patients progress rapidly in front of your eyes over the space of a couple of years. And it really does resemble a condition that people will be perhaps more familiar with, motor neurone disease, which again robs patients of their ability to walk, speak, swallow. So it tends to be more motor neurone disease-like in its progression. It is really a difficult disease for patients and families to watch their loved ones progress in that nature, for sure.
You mentioned MND there, and as I've reported on before, thanks to the magnificent support of the British public for the likes of the Dodie Weir and Rob Burrow charities, we've seen an upturn in research funding for MND. How does that compare to PSP and CBD?
You raise an excellent point because the funding landscape for PSP and CBD research is vastly different compared to MND. And that's despite the fact that the conditions are just as common as each other. So we estimate that up to 10,000 people are living with PSP in the UK, which is pretty similar to MND. Yet the funding landscape is vastly different. But thankfully, in more recent times, there's been increased awareness of rare diseases like PSP. So we are seeing a lot of interest in funding bodies, funding research related to PSP and CBD, but we've got a long way to go for sure. I mean, we really do strive to improve the funding opportunities that we see for these diseases. And the research community as a whole is pulling in the right direction with regards to that. One thing I will say as something to be hopeful of is that a lot of the work that we're doing at UCL and other groups are doing around the world is there's a lot of interest in developing new potential treatment targets for the condition. So the clinical trial field in PSP and CBD is very active at the moment. So we are hopeful that there will be positive developments in the next few years.
I know from talking to you off microphone, you and your colleagues in association with US scientists are working on a diagnostic approach which, in the very near future, may help substantially cut down the time to successful diagnosis, which is really encouraging. Back to the here and now, living with a rare condition can be extremely isolating, and I know you want to highlight the importance of reaching out to gain support.
Yeah, absolutely. And I think that's where I really would like to highlight the incredible work of the PSP Association. So the PSP Association is a UK-wide charity that supports patients and their families living with PSP and CBD. It's an excellent resource in terms of simple information about the conditions when patients feel in the dark, but also there are practical things that the PSPA offers in terms of prism glasses, for example, for patients who have trouble looking up and down, or advice about financial support that may be available to patients. Another thing from a support perspective is that the PSP Association run local support groups up and down the country. And our patients report time and time again that to have that interaction, that contact with other patients and other families going through the same thing is really therapeutic for them.
My grateful thanks to Ed Jabbari. To connect through to the PSP Association, visit our website, wordonhealth.com. That's wordonhealth.com.
Word on Health. For your very best of health.
According to the Sepsis Trust, around 245,000 people were impacted by sepsis last year. 48,000 sadly died, thousands of which the charity claim could have been prevented. UK health systems don't currently require all hospital staff to complete specific sepsis awareness training as a mandatory statutory obligation. Instead, training is encouraged and often provided, but it's up to each trust or health board, and practice varies between trusts and regions, which can impact on timely intervention. Dr. Ron Daniels, the UK Sepsis Trust founder and joint CEO, explains what sepsis is.
Sepsis is the way the body responds to an infection. The body's immune system overreacts, and if we don't stop it, that starts to damage our own organs, which of course can lead to death.
Dr. Daniels' survey data shows that 91% of the public recognise sepsis as a medical emergency. There's limited understanding of the symptoms, which differ, of course, for children and adults. Whilst it has to be said sepsis can develop in anyone of any age, are there factors that increase our risk?
So someone who's in their 80s and above is more likely to develop sepsis. Similarly, at the opposite end of the age spectrum, a child under 1 year of age have a higher risk of developing sepsis than a school-age child. There are conditions which put people at increased risk of infection. Examples include diabetes, people with COPD or chronic airway disease. There are risk factors according to what's happening within our lives. And a particular example is women who are pregnant, who have recently been pregnant. And then there are risks associated with our immune system, factors that make our immune system react abnormally, treatment with steroids, treatment with chemotherapy.
So talk me through those signals of sepsis and the difference between children and adults.
In adults, they spell the word sepsis. S for slurred speech or confusion. E for extreme pain in the muscles or joints. P for passing no urine in a day. S for severe breathlessness. I for it feels like I'm going to die, and people really do say that. And the final S for skin that's mottled or discoloured or very pale. Any one of those six in an adult or older child in the context of infection, it's go straight to A&E. Now in children, the symptoms are slightly different, but the common factor is behavioural change. A child who is curled up in a ball, won't show interest in anything, who is very lethargic, who's very difficult to wake. Children tend to show changes in their skin colour and temperature earlier than adults. So some of the symptoms in children include, of course, that rash that doesn't fade when you press it under a glass. But also, if a child's skin is very mottled, if it's abnormally cold to the touch, or they're very, very pale indeed, if their breathing is very much quicker than normal, then that is worrying. Of course, if they have a fit or a convulsion that can happen with sepsis, and indeed with high temperatures, then that's another cause to get them straight to A&E.
I know that you're pushing for mandatory training for all clinical staff in sepsis so that we can cut that out of the equation when it comes to diagnosing people quickly. And of course, it has to be said, with timely intervention, they can survive. But we have to recognise that there can be a burden with survival, which I know a lot alongside raising awareness and pushing for change, your charity exists to help with?
About 40% of people who survive sepsis have life-changing consequence at 1 year. That might be fatigue, it might be pain, it might be something as seemingly trivial, but to many people quite important, as brittle hair, brittle nails, loss of teeth. It can also include loss of limbs and digits in extreme cases, short-term memory loss, problems with concentration, problems with judgment, but it can include people who have such significant change in their thought process that they can't return to work at their previous level of function. People can have a disturbed sleep pattern compared to previously. They can have occasional and not particularly troubling flashbacks. In extreme cases, around 1 in 5 people who survive sepsis have PTSD. We have trained support nurses who can help people understand and give them advice as to how to cope with their symptoms and improve their lives. And I think the final glimmer of hope there is that so many people who are touched by sepsis and who use our services say, yes, my life is changed after sepsis. I am a different person, but it's changed for the better.
My grateful thanks to Dr. Ron Daniels. To find out more about sepsis and link through to the Sepsis Trust, visit our website, wordonhealth.com. That's wordonhealth.com.
Word on Health. For your very best of health.
Almost over half of UK adults have raised levels of it, and research shows while 62% of us know it's a risk factor for our biggest killers, an equal number don't know what their levels are. Professor Liz Hughes is the medical director from Heart UK, the cholesterol charity.
Cholesterol's a blood fat which is vital for good health. It's needed to form cell membranes, make things like vitamin D and various hormones to make bile for digestion. So we get some cholesterol from our diet, but most, about 2/3, is made in the liver. And cholesterol and other blood fats, which are called lipids, are carried around the body in the bloodstream to where they're needed. And they can't travel loosely by themselves. So they're packaged into tiny round particles, which are called lipoproteins. So lipids meaning fat and proteins meaning protein.
Of course, we should say that there is good HDL and bad LDL cholesterol, and recent data shows that 49% of us have never learned the difference between the two.
Low-density lipoprotein, or LDL, carries cholesterol from the liver to where it is needed, and it's the main carrier of cholesterol. And when there's obviously too much LDL in the bloodstream, this can lead to a buildup of cholesterol in the arteries, which can cause them to narrow and over time can lead to heart attack and stroke, for example. And this is why LDL is sometimes called the bad cholesterol. Now, high-density lipoprotein cholesterol, or HDL, carries excess cholesterol away from the cells and artery walls and back to the liver to be either broken down or recycled from the body. This is why it's often called the good cholesterol, or sometimes the protective particle. And this is what's called reverse cholesterol transport. And that's why they're called good and bad.
It's true to say, isn't it, that a great many of us are clueless that we might have high cholesterol. Are there any warning signs?
Anyone can have high cholesterol. Even if you're young, slim and healthy, you cannot feel it. You might have signs. So occasionally people have a white line which can be seen around the colour part of the eye. Sometimes we see people with yellow deposits around the eyes, or possibly some deposits in the tendons of the hands or other tendons. But that's quite unusual. So you can have no symptoms or signs whatsoever until your cardiovascular disease event occurs.
High cholesterol can develop in lots of different people, not just one type, and we have more details on the wordonhealth.com website. The NHS health check for the over 40s automatically checks for cholesterol levels, and if you have a family history of high cholesterol or heart disease, stroke, or a genetic disposition is known, tests can be advocated sooner. Outside of that, for the general population, it never hurts to know, and you can access cholesterol tests through your pharmacist. What's deemed a healthy level?
If we look at a newborn baby, when we come into this life, your cholesterol is about 3.5 millimoles per litre. And really keeping a cholesterol of somewhere around 4 to 4.5 would seem, from all the research, to give you the best outcome of a healthy heart. In general, the population of the United Kingdom, the average is above that. So I think if you see your cholesterol is definitely over 5, you need to have some conversations with your healthcare professionals, because you will need to make some changes. All of the evidence suggests that the lower you can get it, the better.
The good news is high cholesterol can often be reduced or managed through medication and lifestyle changes. And I know the charity you represent offer a wealth of information and support for those of us that need to make those changes.
On our website, we have a very good diet and lifestyle plan called Cholesterol Smart. The Cholesterol Smart program takes you step by step through a plan designed to fit your lifestyle and helping you make manageable changes, which you can do a bit at a time. And there's lots of resources there.
My grateful thanks to Professor Liz Hughes from Heart UK. To find out more and link through to the charity, visit wordonhealth.com. That's wordonhealth.com.
Word on Health. On air and online 52 weeks of the year with Paul Pennington. Word on Health. Your personal prescription for your very best of health.